Hi everyone. We're going to talk about menopause today because we do get a ton of questions about menopause, so I figured I'll explain everything in one go.
When does menopause start?
Yeah, so we get this question all the time. It all depends. Everybody's menopause can start differently. Sometimes, it depends on if you have your mother or your sister, you kind of know when they went into menopause. It could be 51, 52 years. That's the average age of menopause. But I've lately seen many women don't go into menopause until 55 years of age, even. Or you could even go around the age of 45. So basically, anywhere between 45 to 55.
When does menopause end?
That's the big question. It never ends. So what happens is, what is menopause, right? So if you look at this, when you're having normal menstrual cycles, you get estrogen rise, you get progesterone rise in the second half, and then they both fall, and then you get a period. So in menopause, what happens is that the ovaries stop producing any estrogen and progesterone at all because they don't get the brain signals from the brain to the ovaries telling the ovaries to produce estrogen and progesterone. So what happens is it's a complete flat line. As you can see, there's very little estrogen and there's very little progesterone. So this state of affairs essentially goes on until you die. So menopause technically never ends. That being said, the main symptoms of menopause, like hot flashes and very severe, sleep issues, the high intensity of menopause symptoms usually lasts 5 to 7 years. And that's usually what commonly people refer to as menopause ending, but technically it never ends.
What is HRT?
It's hormone replacement therapy. Now, hormone replacement therapy means same thing, right? The estrogen and the progesterone that your body was producing every month is no longer happening. So we can replace this estrogen progesterone that was being produced by the body by medications. Now, I know HRT has a bad rep, and many people think it causes cancer. And there was a lot of advertising and a lot of Google searches and everything say, oh, you may get cancer. You have to be careful. You have to understand the right type of hormone replacement therapy given to the right kind of person, as long as it is the same type of estrogen that our body produces naturally, which is called bioidentical hormone replacement therapy. As long as that's being used, it should be safe. Now, again, that being said, if you are already prone to getting breast cancer or are going to get breast cancer, then you may get breast cancer anyway. So it's not that the estrogen caused that breast cancer, but you already had a predisposition to it, and maybe that's why you got it. So you have to be careful when you go online and search for HRT. For us, the HRT should be balanced. It should be estrogen, natural or bioidentical, plus the progesterone together. Whether you had your uterus removed or not, you should always take estrogen and progesterone both. And I'll tell you why. Estrogen is needed for your bones, your heart, your skin, your hair, brain fog, sex drive, everything that we work on, right? Progesterone is also needed for your bones and especially for your brain. You know how many of you start getting mood changes around perimenopause? It's because of the lack of progesterone that's happening here. So, old school thoughts used to be don't take progesterone if you had your uterus removed. That's not bad. According to me, that's criminal. So we should be giving bioidentical estrogen and progesterone to the right candidates, and I'm going to talk about that as well. But that's what a balanced hormone replacement therapy entails.
What are the risks of contraindication?
Risks of hormone replacement therapy, or who's the right candidate? Let's start with that. Um, if you do not have any history of blood clots, like history of strokes, history of blood clots in your legs or lungs before, then hormone replacement therapy is okay to give. But if you've had blood clots, strokes, or if you have liver disease, then you cannot metabolize the estrogen properly. So you have to be very careful. In some situations, if you're stable and you don't have risk factors and you got a stroke, say because you had an accident, we could give you low doses of estrogen through your skin, which is called transdermal. So every person has to be individualized. Everybody's care has to be individualized. Other risks, some people may feel a little bit water retention or bloating in the first few days, but your body gets used to it very well. Sometimes you can overdose on it, so this is why we monitor your levels through different methods, through urine, saliva, or blood work every few months. Um, yeah, that's pretty much it.
When should I come into my GYN?
So first time when you start seeing symptoms, like when your periods start to space out, or you start getting hot flashes, or you start having low sex drive, feeling vaginal dryness, your hair starts falling out, you feel moody, your family doesn't want to be around you, you should come to your GYN then. And then once the GYN evaluates you, and I have another video explaining exactly how we should start hormone replacement therapy if you are in perimenopause, because it's not straightforward. If it's not started or given correctly, it can really mess you up. Um, After you get hormone replacement therapy prescription, you should be coming to your GYN every 3 months, no matter what, because it is eventually a medicine. It needs to be monitored, and if we give it to you without monitoring, then yes, it can cause cancer, liver damage, and stuff like that.
Great, those are all my questions. Thank you.
I do want to tell you something important. With hormone replacement therapy, works on receptors on your cells, right? So the receptors are basically can get completely filled up with the hormones, and the body stops reacting to the hormones if we keep giving the same dose constantly. So this is why it's very, very important to take a holiday. We call it a drug holiday from the hormones. And I usually recommend taking a week break every 3 months. Otherwise, you don't see any, you stop seeing the effects from the hormones. So extremely important. Or you can remember maybe every long weekend you could take a week off. This way it's easy to remember, but you need to reset those receptors. And I think that's it for now. And if you have any more questions, you can always come in. We have 5 locations in New York. You can come into any location anytime. Thank you.